I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More here.
Welcome to this episode of IDD Health Matters. Our guest today is Rachel Potts. Welcome, Rachel.
Thank you, Craig.
So, Rachel, you're a nurse, right? How long have you been a nurse?
I've been a nurse for about 8 years.
And how long have you been working in the field of healthcare for people with intellectual and developmental disabilities?
Going on a year and a half.
Year and a half. Okay. So tell us about, how did you find out? First of all, how did you find out about this area of healthcare?
Well, I found a position local to Cleveland, where I'm from, and it was a school nurse opportunity for little ones from pre-K to 21 with autism.
Okay.
And it was a boarding school and day school program. So I chose that position and I fell absolutely in love.
It's kind of one of those things you find out pretty quick if it's for you or not, isn't it? Yeah. So what did you like about it?
There was always something different every day. And learning how to communicate with those who weren't necessarily verbal was a challenge that I truly enjoyed. Being able to find out what's going on with one of my kiddos on an off day when others couldn't was almost kind of like being a detective. And I really enjoyed that.
I get that. I get that, that aspect of it. And, you know, I always talk about sometimes, you know, it's not always what we hear or what a person tells us, but it's what we observe. And we see changes in a person that can indicate something might be going on sometimes,
Yes.
right? Yeah.
Yes.
So those observation skills can be very, very important.
Mm-hmm.
So in your background, in your nursing training, did you receive any training to work in this field?
Nothing formal. And I think that it's a downright shame.
I couldn't agree more. And that's one of the frustrations, actually. And one of the things that I really try to work towards is to provide training and education to healthcare providers because it is so important.
That it is. It's something that affects everyday life. And I want this community and this population to be able to get the best possible healthcare that they can. And it's important for us as providers to take that time to get that education and seek those resources.
Yeah. Have you had, has it been easy for you to find resources related?
No,
Yeah.
Not at all. Actually, when I'm currently a director of nursing and I am over ICF homes and waiver homes. It's only been a few months, so definitely still learning a lot. And just trying to find resources to educate myself has been super difficult. There you have the DDNA, the Developmental Disabilities Nursing Association. And yeah, you can get that certification. But if you don't go to a boot camp or something along those lines, how do you study for this certification?
That is a very, very good point because it can be very challenging to find information about this field. I felt the same way years ago, and when I learned about a similar organization called AADMD, the American Academy of Developmental Medicine and Dentistry, was the first time I felt like, wow, there are other people in this same situation, and this is a place that I can get some resources from and some support as well too, because there aren't as many people that work specifically in this field, and sometimes you feel kind of isolated.
Yeah. I have a primarily behavioral health background, so I had some IDD sprinkled throughout, but not any formal education on how to manage those with IDD.
So when it comes to health and helping people with intellectual and developmental disabilities have good health, what are some of the challenges that you find?
Communication's usually the big one.
Yeah.
They can't always tell me what's going on with them, so it's important we get to know our clients as best as we can. And running into other providers who haven't had formal training or maybe have their own thoughts or experiences regarding those with ID, and just they don't really know how to treat them person-centered. And
I like what you said about maybe have their own thoughts, because I think this is something that we all do this. It's just a fact we have to understand. But we all have biases, our own biases against. Not I hate to even use the word against. We just have our own ways that we view life in all aspects, and that includes people with disabilities sometimes. And I think that does affect how we provide support and how we provide care. If we come in expecting very little, or expecting things not to go well, or expecting people not to be able to tell you anything, then you won't even be open to recognizing that maybe somebody is telling you something, but they're telling it to you in a different way, such as maybe through a behavior rather than actually being able to verbalize what might be going on with them. So,
Agreed.
yeah, so it's really important, I guess, for us to understand what we bring into the situation sometimes, and how we need to open views.
Open our horizons. And even like cultures, different cultures don't treat those with special needs the same way that we do here in America sometimes. So it's being respectful of that. And I always try to come from an open heart and lead by example.
So do you have any particular stories where something was just fantastic related to the care that you provided, or that the support that a person was given?
Well, one of my very first hemorrhages that I dealt with as a nurse was in my school setting with one of my students who had autism. She decided that she no longer wanted this tooth that was hurting her to continue hurting her. So she decided to pull it out.
Oh, wow.
And, I've been at this school for a couple of weeks, and the teacher goes, oh, yeah, the tooth fairy came, nonchalant. And I said, oh, I got to get those little charger tests. And I walk in, and there's just blood.
Oh, no. Oh, no.
Everywhere. And, it sounds terrible, but she got it out and she wasn't in pain anymore. And she trusted me enough to be able to actually put some stuff in there to stop the bleeding. Yeah. Believe me, I didn't really want to stick my fingers in there, but it was a good outcome despite how it had to happen.
And she had trust in you, which is important. And the other part of that is, I wonder if there could have been some way for someone to identify a little earlier than for her to have to pull out her own tooth that it was hurting, that something was going on.
Yeah. And it was definitely a learning experience for all of us, because it had not been the first time in her life that she had done this.
Wow.
And she was known to be a student who would bite. So it was kind of one of those things, looking back, this might be a little too funny, but a root cause analysis.
Very appropriate.
Looking back at it, it was like, oh, well.
Not a root canal analysis.
No. Offering something cool. I'm a big fan of popsicles for tooth pain. Sometimes it works, sometimes it doesn't, or a cool wash rag or something along those lines.
Yeah. I think the key is being attuned to a person and recognizing subtle changes or differences that can clue you into some of these things that might be going on, so that you can get help earlier.
Absolutely.
I probably would pull my own tooth out if it was hurting for a long, long time, and
nothing was done.
Yeah.
I couldn't tell you.
Yeah.
And then I'll show you.
And that is why education for healthcare providers, to me, is so important and so valuable, so that we learn to recognize different ways that people communicate health problems.
Yeah.
And that not only benefits people with intellectual and developmental disabilities, but it really can benefit clinicians that work in any field, people that are aging, people that have dementia, that have trouble communicating, people with traumatic brain injury, children even, so this education really goes beyond, I think, just people with intellectual and developmental disabilities.
I agree.
Yeah.
And coming from someone who deals with mental health disorders primarily, you run into a schizophrenic, and they can't communicate with you always, or even somebody who's depressed and catatonic. How do you go about communicating with them? It's all about learning those different styles. I also keep an AAC device on my phone.
So AAC, that's what is it? Augmentative and alternative communication,
Yes.
something like
Yes.
that. Yeah.
So
But it's a way-
uses visuals. So it would, instead of, saying apple in words and letters, it would have a picture of an apple. So that way, that helps me sometimes with some of my nonverbal clients, if they're not feeling well, to point to the body part on my phone, or it'll say sick with, a green face kind of thing.
That's actually a great recommendation for all of us to have.
Yeah, and they have free versions. I'm an Android person, but I'm sure they have them on iPhone too.
Yeah. Well, that really is pretty cool.
Mhm.
Yeah.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So one of the things I like to ask guests are to give us three things that they think could improve health and wellness or improve supports and services for people with intellectual and developmental disabilities. So maybe three things you learned along the way that you'd like to share.
Three things is our own communication with each other. I feel like sometimes we drop the ball, when you have multiple providers for one individual. Okay, podiatry says one thing, then our endocrinologist says another thing, and then primary says another thing. And we really got to work on that.
So having better communication between providers as well as team members. Yep.
Yes.
Yep.
So like collaboration, making a decision, maybe Johnny's behaviors are not psych related, maybe they're medical related. Let's rule out everything medical before we start throwing in the psych things. And then lastly, listen to your DSPs. Listen to the people who are with your client every day, day in and out.
That is paramount, I believe. We all have different ways we communicate. And, as a medical person, we have certain language we use that can be challenging for other people. But just because someone doesn't have medical training doesn't mean they can't tell you extremely valuable information about that person. Mm-hmm. And so, we don't want to write off anybody's thoughts, especially someone who knows that person the best. Absolutely. And I think us as healthcare providers could probably get better at, first of all, understanding that a direct support professional or someone else or a family member has a lot of very valuable information. And maybe we need to learn to ask better questions to help them tell us what we need to know.
In your lecture before, I shouted SBO.
Yep.
And it just, I didn't even think about it, but a layperson would be
small bowel obstruction, but otherwise, most people wouldn't.
But even that term of phrase, a layperson wouldn't be
that either.
So it's just being mindful.
Yep. And speaking a common language, it can facilitate better healthcare visits for all of us. Well, Rachel, thank you so much for being with me today, taking the time to talk to us, and for the incredible work you're doing in the field.
Thank you. I appreciate being here.